Okay, Andrew, thank you for that update. Let's take you live to Jeannette Young.
The first piece of information is we've not had any new cases in Queensland overnight, which is exceptionally good news. We're not out of the risk period yet, but we are doing much, much better than I thought we would when I first was notified of this cluster. So Brisbane Youth Detention Centre cluster looks like it's well and truly in hand, and we should be able to declare it over in the next few days. So it looks as if none of the children who are in that centre have contracted the virus, which is very good, and it looks as if all of the staff have now been managed and we haven't seen any more spread. Then we had the academy cluster, and again that one's not complete yet, but we're getting more confident that we've managed to control that. Then we had the Arthur Gorrie Centre cluster there with the number of staff who are positive. Again, we're hopeful that none of the prisoners have contracted that infection there, so that is good news. Then more recently, of course, we've had those staff at Ipswich Hospital who've tested positive, and now we've got a school there associated with that, so we're just working through that. But it is really good news that today we've had no new cases. Now, all of these, I do unfortunately need to remind people, go back to one, possibly two young women who contracted the infection in Melbourne and brought it back into Queensland. That's the most likely scenario, and that's even more likely now that we've done so much testing out there and not found any other chains of transmission. Indeed, today I'm very, very pleased to announce that we've done more than 1 million tests for COVID-19 in Queensland. So that's in the 8 months that this pandemic virus has been circulating in Queensland. And I do want to thank every single Queenslander, all 1 million who have come forward to be tested for this infection, and that's what we have to keep doing. If we can find the first case rather than the 40th case, we know we've got a good chance of getting on top of it. With this most recent cluster that started in the Brisbane Youth Detention Centre, we didn't find the first case there. We found subsequent cases. And that's why it has taken longer to get on top of this cluster than previous clusters. So I do ask every Queenslander, please, if you're unwell, come and get tested. Today in Queensland, you are far more likely to have COVID-19 than you are to have flu. That's how much more the risk is for a Queenslander today. So that is very, very important.